Hello students, welcome to Academia. Today I will discuss the disorders of adrenal gland. In our previous discussions we know about adrenal gland, its structure and the hormones secreted from this gland. So we know already that the adrenal gland is a conical shaped gland which have a cortex region and the medulla. So the cortex release different type of corticoids which are divided into glucocorticoids, mineralocorticoids and sex corticoids from the three different layers, that is zona glomerulosa, zona fasciculata and zona reticularis. And the medulla is also responsible for release of the hormones. So what happens if the hormones secreted in much amount or in less amount? So today we see one of the important disorder of adrenal gland, that is Cushing's syndrome. So what is Cushing syndrome? The Cushing syndrome is characterized by excess secretion of the adrenal cortex hormones. So the adrenal cortex hormones, if they are secreted in excess amount, so this Cushing syndrome is a very important type of disorder. And what are the causes? So the causes are first of all the iatrogenic causes, that is excessive cortisol levels from chronic therapy with glucocorticoids. Now, the primary cause are excessive cortisol production from adrenal neoplasms such as different adenomas or carcinomas. The secondary causes are excessive production of adrenocorticotropic hormone, that is ACTH. And we know that the ACTH is secreted from anterior pituitary gland. And due to the pituitary carcinoma or due to ectopic region, the ACTH secretion increases. The risk factors in case of the Cushing syndrome are first of all, the women's are 5 times more likely than men. The women of age 20 to 40 years are much likely to have this disorder. Long-term corticosteroid therapy is also one of the cause, and of course family history. So these are the likely risk factors due to this the Cushing syndrome occur. So next, here the image shows that the hypothalamus, which release the CRH, that is corticotropin releasing hormone, to the anterior pituitary, and these are called the releasing hormone. Generally all the releasing hormones are secreted from the hypothalamus, which stimulate the pituitary gland, that is the anterior part of the pituitary, and that anterior pituitary release ACTH, and ACTH act on the adrenal gland to release the cortisol, and hypercortisolism occur due to the high level of ACTH, and if the ACTH level increases, then the hypercortisolism occur. The pituitary adenoma is insensitive to the effect of negative feedback inhibition, and that's why in the regulation of the ACTH, there is a negative feedback, and that's why the ACTH production increases, and as well as the cortisol production also increases. Next, moving to the pathophysiology, that is, if we use the corticosteroid medication and excessive corticosteroid production by the adrenal cortex, it causes the tumor of the pituitary gland that produces ACTH and stimulate the adrenal cortex rather than the normal level. The normal feedback mechanism become ineffective, leading to the loss of usual diurnal pattern of cortisol, and oversecretion of cortisol hormone then occur, and it leads to the different symptoms like the moon face, red cheeks, and red striations in the abdomen, thin arms, legs, etc. That is, as a whole, the disorder occur, which is called Cushing's syndrome. So, for the treatment purpose, the abdominal X-rays are done. The adrenal calcifications may be noted if the adrenocortical insufficiency is secondary to tuberculosis or fungal infection. Abdominal CT scan also done. Some adrenal glands idiopathic atrophy or long-standing tuberculosis is found. So, the Cushing syndrome, as we know, that it occurs when our body has too much of the hormone cortisol over time. So, this situation occurs, as we have seen, that if we take the oral corticosteroid medication, or our body produce a huge amount of ACTH, and which lead to the production, much production of cortisol from the adrenal cortex. Now, moving to the signs and symptoms of Cushing's syndrome. So, the most common signs and symptoms are weight gain and fatty tissue deposits, and due to the deposition of fat, the face looks like moon, and it is called moon face, and between the shoulders also there is deposition of fat, and which is called buffalo hump. Pink or purple stretch marks on the skin, basically in the abdomen region, thighs and the breasts, arms, etc. Thinning of fragile skin, slow healing of cuts and infections, and acne. So these are the very much common signs and symptoms. In the image next, we can see, you can easily understand that about the signs and symptoms. But in women and men, some specific symptoms occur, like in case of women, the thicker or more visible body and facial hair which is called hirsutism, and irregular or absent menstrual periods. So these are the thing. In case of men, the decreased sex drive, decreased fertility and erectile dysfunction occur. So these are about the signs and symptoms, but some other features also there, like the severe fatigue, muscle weakness, depression, anxiety, loss of emotional control, cognitive difficulties, new or worsen high blood pressure, headache, infections, skin darkening, bone loss. So different type of symptoms occur when a person having Cushing syndrome. So the image next shows all the signs and symptoms of the Cushing's syndrome. So if it is not treated properly or in proper time, the complications like osteoporosis, too much hypertension, diabetes and infections occur. So hope in today's video, as we have seen about the cause, pathophysiology, sign and symptoms of Cushing syndrome. If you have any query or question regarding this, you can ask or can comment in the comment box. Thank you.